Hey everyone, when dealing with recurrent miscarriages, I always like to sit down with patients and go over a list of evidence-based modifiable risk factors that have been shown to either increase the risk of miscarriage or decrease the risk of miscarriage. And I find the initial response I get from patients is a bit of surprise because they've often been told that there's really nothing that can be done regarding their miscarriage risk, especially when they've gone through multiple miscarriages and they haven't been able to find anything that may be causing this issue. So while we're going to discuss a new research paper that was published recently and some very important risk factors they've discussed, this list is not exhaustive, it's not complete, but we are going to just touch on some very important topics and very important factors that can significantly impact chances of miscarriage, according to the newer research. So first off, when we look into the ability to successfully get pregnant and keep a healthy pregnancy, one of the biggest factors we're seeing that can impact chances of success is actually the BMI, or body mass index. So this is it's kind of a not the most accurate test to determine. Basically what we're looking for is a lot of visceral adiposity, or fat tissue that's accumulated mostly around the abdominal, the midsection, and weight in general. But what it doesn't account for is muscle mass. And a lot of patients have low body fat percentages or healthy body fat percentages, but a lot of healthy muscle mass, so lean muscle mass. And the BMI will appear to be elevated, but it's not actually unhealthy. So it's not a perfect measure by any way, but it is one of the most accurate measures we have when determining risk for miscarriages based on weight. And can sometimes be combined with another one called waist to hip ratio, which is a measurement that we'll check to see what the circumference on the hips and the waist are, and if we're seeing an imbalance, or the waist is much more or higher in circumference than the hip, then they're usually it's associated with an increased risk of certain cardiovascular events and poor health outcomes. So with the fertility research, it's mostly focused on BMI, and what we've seen in terms of actual statistical increases in miscarriage risk is in the general population for patients who have not had a miscarriage before. If the BMI, or the body mass index, is above 25, and this is what we would call overweight, the miscarriage risk is around 20% higher compared to a patient that, for example, has a BMI in a healthier range, such as 20 to 25. And the same thing happens if the patient is underweight. So if we're seeing that the BMI is below 19, we also see that the chance of a miscarriage in the general population might be about 20% higher for these patients. Now, when we're looking at the general population, we're not looking at patients who've actually experienced recurrent pregnancy loss, which is defined as 3 consecutive miscarriages. Now, when we look specifically at patients who have experienced recurrent pregnancy loss, if the BMI is above 25, that risk goes up by about 35%. So the chance of miscarrying if the BMI is above 35 and the BMI is above 25 and the patient has a history of recurrent pregnancy loss, the chances of them miscarrying again is about 30% or higher compared to someone who has a BMI in a healthy range. So they're at a 30% higher risk compared to that patient in a healthy BMI range. And if the BMI is above 30, then the chances are actually for miscarrying are almost 70% higher compared to a patient that has a BMI in a healthy range. So that BMI seems to have a big impact. And these are associations. These are not cause and effect, so they don't establish causation, but they are worrying associations that we have seen with miscarriage risk and with other health outcomes as well. The higher BMI is associated with a lot of adverse health outcomes, such as cardiovascular disease, diabetes, mood disorders, etc. So the weight seems to be a very important factor here. And in addition to that, this newer research paper also looked at some other common, I think, curious questions that we usually think about, like for alcohol, caffeine, that sort of stuff. So for caffeine, for example, they looked at, if a patient was having more than 100 milligrams of caffeine versus less than 100 milligrams of caffeine, were they at a higher risk of miscarriage or not. And so For that, they found about a 12 to, I believe, about 10 to 12% increased risk of miscarriage for patients that are having greater than 100 milligrams of caffeine. And the research in this area was pretty small studies and not a lot of studies. So we definitely need more data to back these numbers up. But this is the association we're seeing in these recent studies so far. And with alcohol, if patients are consuming alcohol versus those who aren't consuming any alcohol, there's also a statistical increase in the risk of miscarriage. And it was around 12% as well. So patients who consumed alcohol were approximately had a 12% higher risk of miscarriage compared to patients that didn't. And they didn't break down into how much alcohol, what kind of alcohol, like hard alcohol versus wine versus beer. And they didn't compare amounts of or units consumed in a week either. So that data was also lacking, but we are seeing this association. And so when we look at miscarriage risk, we also discussed so many other things in our previous research posts. We've looked at the role of the microbiome. We've chatted a lot about the sperm DNA fragmentation rates, egg quality, and the genomic stability for the follicular DNA as well. So there's a lot of these other factors that also play into what the risk of a miscarriage is. But it's very interesting to me that we can look at these lifestyle factors as well and how they may actually impact levels or risk of miscarriage before pregnancy again. And I think the most important thing for patients is when they go through a recurrent pregnancy loss is there's a feeling of there's nothing that can be done. And I don't feel a lot of these patients have been given that kind of empowerment. Hey, like this is like the data, this is what we know so far. And these are some things that may actually impact or reduce your chances of miscarrying again. So I find it's very valuable to share this information, to share this data with patients. So you actually have, the information to make an educated and informed choice on how you would like to prepare for your next pregnancy, or if you are planning to get pregnant down the road, what, things you can be doing to help get your body into a state of better health to help support a successful pregnancy. And so, as always, if you guys ever have any questions, you're welcome to send us a direct message or drop us a message here, and we'll be happy to get back to you. Have a great day, everyone.